You wake up, your feet don't fit into your shoes, and your legs feel heavy. Could it be lymphedema? Let's find out and tackle this together. Today we're diving deep into the world of lymphedema, shedding light on its causes, and most importantly, unveiling practical strategies to control swelling in your legs and feet. From innovative medical treatments to simple home remedies, we'll explore all avenues to help you reclaim your comfort and mobility. Stick with us until the end, as we reveal expert tips and some lesser-known facts about lymphedema that could dramatically enhance your quality of life. You won't want to miss this comprehensive guide to battling one of the most perplexing conditions. Overview of lymphedema. Lymphedema is a chronic condition characterized by the accumulation of lymph fluid, leading to swelling in parts of the body, most commonly the legs and feet. This swelling occurs due to a malfunction in the lymphatic system, which is responsible for removing excess fluids from body tissues and aiding in immune system function. There are two main types of lymphedema, primary and secondary. Primary lymphedema is less common and usually results from genetic factors that affect the development of the lymphatic system. It can manifest at birth, during puberty, or in adulthood without any apparent external cause. Secondary lymphedema, on the other hand, develops as a result of damage to the lymphatic system. This damage can occur due to infection, injury, cancer treatment, particularly surgery and radiation therapy, or other conditions that affect lymphatic flow. The progression of lymphedema typically leads to a range of symptoms beyond swelling, including a feeling of heaviness or tightness, restricted range of motion, recurring infections, and hardening of the skin. These symptoms not only cause discomfort, but can also significantly impact the quality of life, making early diagnosis and management crucial. Causes and risk factors. Understanding the causes and risk factors of lymphedema is vital for both prevention and management of the condition. Genetics play a significant role in primary lymphedema, with mutations affecting the development of lymphatic vessels being a key factor. This genetic predisposition means that individuals with a family history of lymphedema are at a higher risk of developing the condition themselves. Secondary lymphedema has a broader range of causes. Surgical procedures, especially those involving lymph node removal such as mastectomy for breast cancer, significantly increase the risk of developing lymphedema. Radiation therapy, which is used in the treatment of various cancers, can also damage lymphatic vessels and lead to swelling. Infections that damage the lymphatic system, including severe cellulitis or filariasis, a parasitic infection, are additional risk factors. Furthermore, lifestyle factors such as obesity can exacerbate the risk and severity of lymphedema by putting additional strain on an already compromised lymphatic system. Recent studies published in journals such as The Lancet and Journal of Lymphedema have highlighted the complex interplay between these risk factors and the development of lymphedema. They emphasize the importance of early detection and intervention, especially for individuals undergoing cancer treatment or those with a known genetic predisposition to the condition. These studies suggest that proactive management of risk factors, such as maintaining a healthy weight and taking preventive measures during cancer treatment, can significantly reduce the incidence and severity of lymphedema. Early signs and symptoms. Identifying the early signs and symptoms of lymphedema is crucial for timely management and can significantly impact the effectiveness of treatment strategies. The initial symptoms often manifest subtly and may include a slight swelling or puffiness in the limbs, particularly in the feet and legs, which might be more noticeable at the end of the day and diminish overnight. This early-stage swelling is often overlooked or mistaken for temporary fluid retention. However, recognizing it as a potential indicator of lymphedema is key to preventing progression. Additional early signs include a feeling of heaviness or tightness in the affected limb, decreased flexibility in the wrist or ankle, and tight-fitting jewelry or clothing without apparent weight gain. As the condition progresses, symptoms may become more pronounced and include significant swelling, changes in skin texture, such as thickening or hardening, and recurrent infections in the affected area. A study published in the Journal of Clinical Oncology emphasizes that early detection and intervention can significantly reduce the risk of these more severe symptoms and improve long-term outcomes for patients. Diagnosis and assessment. The diagnosis and assessment of lymphedema involve a combination of clinical evaluation and diagnostic tests aimed at determining the presence and extent of the condition. Healthcare professionals begin with a comprehensive medical history to identify any underlying risk factors, such as a history of surgery, radiation therapy, or familial predisposition to lymphatic disorders. Physical examination plays a critical role in the diagnostic process, where clinicians assess the extent of swelling, skin changes, and signs of infection. Several diagnostic tests may be employed to confirm the diagnosis of lymphedema and rule out other causes of limb swelling. Lymphoscintigraphy, a specialized imaging test, is considered the gold standard for diagnosing lymphedema. This test involves the injection of a radioactive dye into the lymphatic system to visualize the flow of lymph fluid and identify blockages. According to research published in the Journal of Nuclear Medicine, lymphoscintigraphy is highly effective in distinguishing lymphedema from other types of edema, providing detailed images of lymphatic drainage patterns. In addition to lymphoscintigraphy, healthcare providers may use ultrasound, MRI, or CT scans to assess the condition of the lymphatic system and surrounding tissues. Bioimpedance spectroscopy is another non-invasive test that measures the electrical impedance of body tissues, which can be altered in lymphedema due to increased fluid content. A study in the British Journal of Community Nursing highlights the utility of bioimpedance spectroscopy in early lymphedema detection and monitoring. Early recognition of lymphedema symptoms is essential for effective management, and the diagnostic process involves a thorough medical history, physical examination, and specialized tests like lymphoscintigraphy. Prompt diagnosis allows for timely intervention, potentially preventing the progression of the disease and improving the quality of life for those affected. Management strategies for lymphedema. Managing lymphedema effectively requires a multifaceted approach that combines medical treatments, lifestyle modifications, and the latest technological innovations. These strategies aim to reduce swelling, manage symptoms, and improve quality of life for individuals affected by this chronic condition. Medical treatments. Medical treatments for lymphedema focus on minimizing fluid accumulation and preventing complications. Compression therapy is a cornerstone of lymphedema management, involving the use of specially designed garments to apply constant pressure to the affected limb, thereby promoting lymph fluid drainage. A study in the Journal of Phlebology has shown that consistent use of compression garments can significantly reduce limb volume and discomfort in lymphedema patients. Manual lymph drainage, MLD, is another critical component of lymphedema treatment. This specialized form of massage, performed by trained therapists, helps to stimulate the flow of lymph fluid away from the swollen areas. Research published in the Journal of Lymphedema demonstrates that MLD, in conjunction with compression therapy, can enhance the effectiveness of lymphedema management strategies. Surgery may be considered for patients with severe or refractory lymphedema. Surgical options include lymphaticovenous anastomosis, lymph node transfer, and liposuction for lymphedema. These procedures aim to restore lymphatic drainage pathways or remove excess fat and fluid from the affected limb. According to a study in the Journal of Plastic and Reconstructive Surgery, surgical interventions can offer significant improvements in limb volume and quality of life for selected patients. Lifestyle and home remedies. Incorporating specific lifestyle changes and home remedies can greatly support medical treatments in managing lymphedema. Regular exercise, particularly low-impact activities like swimming, walking, and yoga, can improve lymphatic circulation and reduce swelling. Maintaining a healthy diet rich in fruits, vegetables, and lean proteins helps to avoid excess weight gain, which can exacerbate lymphedema symptoms. Skincare is paramount in lymphedema management to prevent infections, such as cellulitis, which can worsen the condition. Keeping the skin clean and moisturized and treating small cuts or abrasions promptly are essential preventive measures. Additionally, simple do-it-yourself methods such as elevating the affected limb to facilitate lymph flow can be easily integrated into daily routines and help manage swelling. Technological innovations. The field of lymphedema treatment has seen remarkable advancements in technology, offering new hope to those living with the condition. Laser therapy, for example, has emerged as a promising treatment modality. Low-level laser therapy can stimulate lymphatic function and reduce fibrosis, leading to decreased limb volume. A review in the Journal of Lasers in Medical Sciences highlights the potential of laser therapy as a safe and effective option for lymphedema management. Wearable technology is another area of innovation. Devices that provide dynamic compression or monitor lymphatic function in real time are becoming increasingly available. These technologies offer personalized treatment options and enable continuous management of the condition outside the clinical setting. Effective management of lymphedema involves a combination of medical treatments, lifestyle adjustments, and embracing technological innovations. Strategies like compression therapy, manual lymph drainage, exercise, and the use of advanced treatment modalities work together to reduce swelling, alleviate symptoms, and enhance the quality of life for those affected by lymphedema. Adopting a comprehensive approach to management, tailored to the individual's needs and preferences, is essential for achieving optimal outcomes in lymphedema care. Today, we've traversed the complex landscape of lymphedema, from its causes and symptoms to a variety of management strategies that promise relief and improved quality of life. Whether through medical interventions, lifestyle adjustments, or embracing new technologies, controlling swollen legs and feet is within reach. Remember, managing lymphedema effectively starts with understanding and action. Start today, because your journey to recovery and comfort begins now.